Today is our 13th town hall. Today, July 27th, if you can imagine how long this coronavirus environment has been impacting us. And I think now what I'd like to do is just kind of encapsulate some of the conversations that I've been having with employers and leadership committees, and just some other things that are just, inside the CARES Act. You can see that it's really going to be focusing a lot of monies towards driving the schools to be reopening, just because, I'm sure everybody on the call, you read the newspaper, you're listening to the news, and statements are definitely being made that, the path to having the economy reopen is to have the schools reopen. And certainly it's not a secret that we are in election year, and so there's a lot of information that's being thrown on us. But if you kind of look at what they're talking about, certainly increasing testing, vaccine research, but also workplace training and social distancing. That's $1.3 billion, $15 billion on child care, $105 billion towards education, which is split up in a couple different ways. But I think it's just important to understand that, they were clear in their communications that they are going to be focusing a lot of the CARES 4 on education. Clearly, there's, two aisles that we're going to be listening to, and so they have to come to an agreement. So what actually is in the final will be interesting, but that's certainly part of it. From a benefits related, it's interesting. We were very confident that we thought surprise billing was going to be included inside this draft. And from what we're learning is it's most likely not to be. I mean, even though this is a bipartisan issue, and, most of us have probably seen the reports of somebody, being wheeled out of a hospital after surviving it, and then they're showing that they've got, $150,000 of unpaid bills and things in that nature. And we thought that this would certainly be a catalyst from a national perspective for surprise billing. It's just last Friday, the reports I got is that most likely it's not going to be included inside this draft. They're just too far apart from it. Arizona, as I've mentioned in the past, we do have a surprise billing. It has been effective since January 1st. And it's basically set up where Arizona Department of Insurance is going to be involved in helping negotiate a settlement. There's also a ballot initiative. On the ballot this November, there's a group out of California which is putting another surprise billing draft in front of the voters. And if things are passed by voters, it's a different process as far as changing. If someone doesn't like it in relationship to if the legislature themselves passes it. But what they're doing is the state of Arizona has a minimum of 1,000. They want to remove that. They do want to add in some protections for employees and participants inside health plans, which is a positive thing. However, there is a section inside that ballot initiative which is going to include a 20% increase for all employees of a hospital system or facility systems. And it's going to be structured over a 4-year period, so the 5, 5, 5, and 5, and that's probably going to create a lot of tension, I'm guessing, as far as having it being. We'll see some interesting marketing from it, or just conversations from it, because that's the piece where a lot of folks that I'm listening to from downtown, as well as just for our resources, is that they don't like that part of the provision. And if you think about it, that puts pressure on costs inside of a facility, which then puts pressures on PPO contracting, which puts pressures on claims funding, which puts pressures on employee premiums. And so you kind of have this, the cycle where it's not going to help the underlying conversation of too expensive bills and what we pay for cost of insurance. We also have the Employee Flexibility Act. Actually, one of our own Arizona, Kirsten Sinema, was a signer on these, but they are looking for relief in complying with Section 4980H for the ACA. And so just for all of you, that really boils down to that's the provision inside the Affordable Care Act. How do you calculate affordability, what my shared employer responsibility is going to be if I'm 50 people or more. So they are looking for relief for reporting for this year, possibly next year. I don't know if anything is going to be included in it, but they are having conversations about it. President Trump did just sign some executive orders. I believe there was 3 to lower prescription costs. That came out last week. As you know, when he first took office, one of his campaign thing was to hammer on the cost of prescriptions, which it's hard for me to argue with that, because I remember when I started this business, prescriptions were running at 10 to 12% of spend in a plan, and now pharmacy is closer to 30 to 35% spend on a plan. So it's certainly been, an increase in cost over time. And he had some aspiring opinions on how to do it. Nothing went through, and so he's signing some executive orders to help lower this. However, I'm not going to go into too much detail with it because it's expected to hit the courts and probably just kind of get it'll be tied up in courts for a while, most likely. There's also some provisions out there of having some federal payments being provided towards the COBRA coverage, and this is mainly coming out of the House version versus the Senate version. There's speculation why or why not it's included. Some of the speculation is that the House wants to include it because they want to highlight that even though half of our population in the United States receive their coverage through employer-based coverage, layoffs, furloughs, terminations, reduction in staff, that's putting individuals either in COBRA, or if they're not going into COBRA, they can't afford it based upon their income. Then there's certainly going down to access, which is our version here. And so I think speculation is that they're using that to highlight that fact. It's not a right or wrong. It's just something that we're seeing that's going to be included, or at least we'll see elevated conversations about it. I don't know if it'll be included or not. So kind of when we're talking with leadership and just really, having conversations where we think things are going, I will honestly say that most of my conversations are very diverse. They are very thought-provoking. However, it seems that there are a lot of overlapping concerns that we all seem to share. First and foremost is what happens if my employees test positive, and it's an interesting shift, because I remember, conversations a couple of months ago, we were really, kind of like, it's probably not going to happen to us. It's more of a, somebody else's company is probably the better way of saying it, will be impacted by that. And we've kind of moved away from that. It's not really going to be if, it's possibly going to be a when. And so then, how is that going to impact me and my organization? And really, am I seriously in a position of going to be in liability? And, we talked about this last town hall a couple weeks ago with Diana. She had mentioned that there are definitely some class action lawsuits that are already showing. And it seems to be steering more towards the class actions versus going on the individual suits. And so I think it just kind of circles back to really we just need to follow the recommendations of the CDC, local agencies. If there is an outbreak inside of our organizations, and Diana, you have a probably better number than this, but maybe if it's 4 or 5 people or some type of a percentage, making a phone call over to the Arizona Department of Health Services. Because if you kind of look at all the protections that are being written and drafted, they all kind of have this backstop that were they following the CDC recommendations? Were they following the local agency recommendations? And so it's just, document. And back to school has been an interesting conversation. Most of us want our kids to go back to school. Some of us don't want our kids to go back to school. And really, I think what we can do from an organizational standpoint is just make sure that we're up to date on telecommuting policies and we're communicating and setting expectations. And if Diana comes back on, she'll say communicate, because that's going to be one of the best ways that. Right. See, I'm clairvoyant at this point. Right. But we also then have the media, and there's continued pressure on us just from the amount of information that we're receiving. And so I think the best way to go through this process from just a leadership perspective is, buttoning up a return to work policies, set standards, and communicate. And it's not So, and I've learned this is achieving two different things. One is that it's giving a better feeling of security, because if something does happen, the participants and the employees understand that there's a process, and it's not going to be a fire drill trying to figure out what to happen. And so that's settling to some of our employee populations, is just knowing that there's a plan. And I know Diana talked about the return to work last time, as well as what was the other way you called it? That escapes me at this point. But then we're also hearing in the news is that there's potentially second viruses coming up. And then this one that I put up on the screen, the multi-system inflammatory syndrome, it's mainly towards the youth, and it's been likened to Kawasaki disease. And it's just, how do we manage not expectations, but how do we, manage all this information that's going to our employee population that's certainly causing stress in our employee population, and just recognizing that, we're all individuals, and we're all going to hear things a little bit differently. We're all going to have opinions. But I think the general thing, and Diana, if I'm wrong, then certainly correct me, is that, but you just kind of have to have a compassionate ear and just understand is that some people are going to be completely fine with this, and some people are going to have a lot of stresses about this. Is that fair?
Definitely fair, but it's also about making sure that in all of this information and all of this stuff that we're not adding to the fire hose of information with our guesses, that we need to be as careful as we can be with our communications, even though we need to make sure that we are communicating on a regular basis, and being thoughtful and listening to our employees about what their worries might be, so that we can make sure that we're handling it in the right way.
Right. I think you said it a lot better than I did. So this is a study that came out of the Kaiser Family Foundation. And for those of you who have never visited kff.org versus .com, they are becoming a wealth of information, and you see them being referenced a lot through just the public speaking, as well as individuals privately in our industry, but you see them referenced in the media. And they do a lot of surveys, and because they're becoming more popular, they're getting more and more participation. And so this is just the issue that came out July 2020, so it's currently relevant. And most of our population, or at least the ones that are coming through the survey, are saying about it's probably going to get worse. And it's interesting, you can kind of see the trend in early April. We all thought it was going to really take a turn for the worse, and certainly there was rising cases. But then I think with the closings and with the quarantining and the physical distancing, I think there was a more security effect. And so we thought that we might be getting behind this, but that shift mentality has certainly changed and has ticked back up to about 60%. 7 in 10 give the federal government fair or poor marks in the coronavirus outbreak. And I'm not here to have a political conversation, but I'm here to say is that without a consensus or some type of solidarity around an event that is affecting all of us as a nation, it's creating uncertainty, it's creating fear, and so I think it's going to be important for us to recognize is that there's just an erosion of confidence, and that's not going to help us. I think this is just Pete speaking versus a position. I just think this is going to be an obstacle for us to, as a nation, move forward until we get some type of solidarity around it. If you just think about what happened in the well, I'm not going to go down that road. We'll have a glass of wine. I can tell you some more opinions on that. Plus, I'm a few minutes over, so I'll continue going. Half of adults say that their state is moving at the right pace and easing social distancing restrictions. So they do show up between the different aisles, whether you're Democrat, Independent, or Republicans. Hotspots have a little bit of a difference, but not terribly much. However, it seems that, I guess the majority are about right or too slowly versus on the too quickly side. So that's just kind of interesting on where we think the public is focusing on. And then this is interesting as well. So this is looking at the public overall versus parents who prefer to have schools open later to minimize the coronavirus risk. And you can see the questions in the dark blue on the left-hand side. It says, is it better to open schools sooner so parents can work and students won't miss out on learning and other services schools provide, even if there's some risk, versus the lighter blue on the right-hand side, it's better to open schools later to ensure risk of getting coronavirus as low as possible, even if it means some students will fall behind academically, miss out, etc. Well, clearly you can see it's a partisan issue, unless your kids are in school. So the top section is looking at the public, whether you're Democrat, Independent, or Republican, but now if you have kids that are in school, your difference of opinion is not so great. But I think a takeaway from here is that, we have employees that live in our society, and they're probably going through these same different thoughts and trying to figure it out. And what Diana mentioned before is, we don't even have guidelines here locally on what the schools are supposed to be providing. I think you said are due on the 7th. And so there are these just additional stresses and just anxieties that are, weighing on, I think, a lot of us. And I know I teased Diana before about doing the pinky swear about coronavirus fatigue, but I think we're getting there if we're not already there. And so I think just the main takeaways from all this is just really what Diana talked about is, be compassionate, be caring, listen. If you need somebody else to listen for you, identify somebody else in the organization that might be better at it. From the not coming back to work that Dennis was talking about, know that it's complicated and there's typically not a right answer. It's just an answer that has to be sought out through a labyrinth of different acts and laws based upon your size and the situation that you're in, and that there is going to be another CARES Act. We're confident it's going to get passed. However, we're not sure when, or maybe it happened while we were speaking, Matt. I think that happened to us one time. But there is going to be some additional relief that's going to come out, but I think we just have to figure out where is that going to kind of help us as organizations kind of move the needle forward, and keeping marketing going and brand recognition and things in those conversations so that we can continue on a growth path. And just for our final quick disclosure, just remember that Arcwood Financial LLC, Arcwood Benefits Consulting, Inc., and Arcwood HR LLC, you obviously know us as Arcwood. We are independent companies of which we are not offering legal or tax advice. Our goal is to provide information to you for assistance in making decisions for your company. We leave the legal and the tax work up to the professionals, i.e. that's why we bring in smart guys like Dennis Hall and Matt Hatfield to join us today.